Hello, my name is Katie Schumaker, and I am a resident counselor with Healthy Minds Therapy. And today I wanted to spend a few minutes to talk a little bit about eating disorder risks and assessing client safety when working with clients with eating disorders. So, starting with who are impacted by eating disorders impact people of all genders, ages, ethnicities, sizes, and sexual orientations. Marginalized groups who do not fit the typical stereotype of what we think of when we think of someone with an eating disorder, such as those who are not white, young, female, and thin, often might go undiagnosed or underdiagnosed and will miss life-saving treatment interventions as a result of this. It's really important as clinicians that we broaden our view of who is impacted by an eating disorder and what those people might look like so that we can help to provide this vital treatment and interventions for underserved populations. Looking now at the risks of eating disorders come with risks across different areas of our lives. They really do impact our physical, psychological, and occupational well being. And when they're present, they can come with really intense risks. The physical risks of eating disorders are very real and quite severe. This has been part of the reason why eating disorders are the second most fatal mental health diagnosis behind opioid use disorders. So, when we look at the physical risks of eating disorders, there's an increased risk of osteoporosis, dehydration and electrolyte imbalance, hair loss, slower wound healing, the loss of period, and this is also very much tied to the development of osteoporosis, especially if the period has been missing for over 6 months. And those who start eating disorders young and during puberty might even have delayed onset of their first menstrual cycle and puberty delay as well. You also might experience esophagus inflammation or tears, fainting or dizziness, long-term bowel problems and issues with digestion, low body temperature or feeling cold regularly, lanugo, which is a fine hair that grows all over the face and body, and cardiac problems as a result of the eating disorder, including potentially heart failure. So the physical risks are quite severe and can impact people across the lifespan at any phase in their recovery. Psychological risks, we know from a lot of research that there's an increased risk of self-harm, suicidal ideation, anxiety and mood disorders, isolation, and obsessive and compulsive thoughts. All of these are not only a result of the high level of comorbidity between mental health disorders and mood disorders with eating disorder diagnoses, but also because of the impact of malnutrition on the brain. Malnutrition on the brain really mimics a lot of the same symptoms as mood disorders, causing an increase in those symptoms for clients who already have those diagnoses present. And looking at occupational risks, we know that there are higher healthcare costs associated with recovering from an eating disorder, and that these eating disorders often disrupt our social and family relationships. Eating disorders really thrive in isolation, and so people who are diagnosed with eating disorders might try to hide their behaviors or detach from social support networks to be able to continue to engage in the eating disorder and to hide the guilt and shame associated with suffering from an eating disorder. It also can present with employment and academic disruptions due to treatment. Treatment, depending on the level of care, does have an impact on our careers and on our academic pursuits. So, if you are entering a residential treatment facility, you might be there for a couple of months and then step down to a PHP where you're there for another couple of months, and then an IOP where you might have limited ability to engage in your work and academics. This could be anywhere from 2 months to 6 months of disruption in your life, depending on what level of care you enter into and how long it takes you to pursue recovery. So, looking now at implementing a safe continuity of care for our clients with eating disorders, it really starts with building a supportive team. Eating disorders do impact our physical and psychological well being, and we should really be working with a whole team of providers to help best care for our clients. This includes working with their primary care physician, psychiatrist, dietitian, and including family support if needed. Working with dietitians are vitally important in eating disorder recovery, and it's important to find a dietitian who does have eating disorder experience. Many dietitians are fantastic and eating disorder informed and will create a diet culture free space where our clients feel supported and safe. And there are some dietitians who do not support a diet free culture when looking at overall well-being. So it's important to find really trusted dietitians that can support our clients' well-being. And family support is incredibly important if we can get the family on board to help support our client. They really provide a safe and supportive place that is vital to long-term recovery and relapse prevention. And then we want to monitor safety. Like I said, eating disorders can come with very significant physical health complications, and we want to protect against those as much as possible by assessing the frequency and severity of our eating disorder behaviors, collaborating with professionals on monitoring labs and vitals, and looking out for symptoms that might be brought up in sessions like feeling dizzy, fatigued, low or high heart rate, or loss of period. And we also want to monitor progress. You can utilize outcome measures and treatment team advice as tools for determining proper level of care. We want to see that our clients are improving and that we're meeting their needs at their current level of care. And some of the outcome measures that are good for using this are the EDEQ, IES2, and EAT26. The EDEQ works on things like weight, shape concern, eating concern, and restriction. The IES2 covers intuitive eating. And the EAT26 will work on things like food, body image, and eating concerns as well. So those might be some really good tools for you to use to monitor your client's progress as they work through recovery. And lastly, it's important to remember eating disorder recovery is not linear and it's often a battle, even when the client is highly motivated. But a solid treatment team can make the difference, and recovery is so worth it. Thank you so much for listening, and I hope that this video was helpful for you.